Welcome to a new episode between doctors and friends. We have here the doctors, Dr. Foz and Dr. Ray, and we have some speakers who attended. Dr. Foz, how are you doing this week? We haven't done this in 2 weeks,
Yeah, I feel like I haven't talked to you guys in like a year and a half. It's only been 2 weeks. I'm
right?
fine. How are you?
I'm okay. I'm okay. I miss you guys. Dr. Ray, how was
Likewise.
your, right? And I'm just moving on to Dr. Ray.
Yeah, shut up, Dr. Foss.
Yeah. I miss you guys. I really miss you guys. Okay, let's move on.
Let's move on. Happy
I'm doing
Mother's Day.
good. I'm doing good. Yeah, just, moving along with my daily stuff, work, family, house, all
I
the
know.
stuff
And I
you
know
need
you've
to
been
do. Yeah.
attending 1-year-old birthdays. How was that?
They were lovely. I went to two little babies who turned one. So they had a big celebration for their first birthday parties. And these were babies that I delivered a year ago. So their families graciously invited me to their first birthday parties, which was very lovely. And because I basically live by myself and have no social life whatsoever, I took them up on their offer because I was like, well, at least I'll, have a reason to get dressed and go have a nice dinner. And so went to the little parties and they were quite lovely, like really nice. Brought me back to, when my children were young and watching all these young little families just sort of starting out and everything. And I'm sort of at the tail end of all of that. So it was a good time, very fun.
Well,
That's really nice.
your
Yeah.
children, are like 20 years, fast forward. Do you feel like, oof, thank God I'm no longer part of that, or do you miss it?
I mean, in a little bit, because I was, the moms are kind of chasing after the kids, and they're some of the kids are throwing little fits and whatnot. But I think for the most part, I missed it. I missed when they were little like that. They were just so happy and playful, and they always wanted to come back and find mommy and sit in mommy's lap or give mommy a hug, or only mommy can pour their milk or whatever it is. So I do miss that like need for me to do everything. My kids don't need me now. And even when I offer to do something like, oh, let me make you breakfast, they're like, no, I can make it myself. I'm like, okay, do you
Wow.
want me to go with you to the grocery store? And I can go by myself. So they're in a different phase of their life. So they don't need their mom to come with them at every point. But this is what I spent 20 plus years trying to teach them, teach them, okay, you have to figure out how to go to the grocery store yourself. This is how you look for the groceries. This is how you buy the fruit. This is how you pay for it. So I've spent that time teaching them, and now, they've done what I've taught them, and but it's sad.
Now, these like baby birthday parties, like, how's the food like?
So the first one I went to was an Indian party.
Wait a minute, Dr. Foz, why are you laughing?
It's just sort of a funny question.
You gotta be curious. What's the food like? Has it improved? Has it changed?
No, I mean, food was the best part of everything, so it always is. So, and then that's part of the enticement of me going. So the first one was an Indian party. So I knew it was going to be full blown Indian party, Indian food, everything. And so that food, is always amazing. So amazing food. They had mango lassi, free drinks, all this stuff. So very, nice, offering of refreshments and food and everything. And the second one I went to was a traditional Chinese first birthday party. So that was lovely as well. And the Indian party was a buffet. So obviously, there's tons of food and you just take what you want to take. The Chinese one, the way, I guess the traditional way that they do it is, everyone's seated at round tables and they have the lazy Susan in front of you and the dishes keep coming. And one of the people I was sitting there said that for the first birthday, they have to have 10 different dishes. So it was,
Wow.
it was barbecue spare ribs, fried chicken wings. I'm going to have to ask them, by the way, where they get the fried chicken wings, because those are some of the best ones I had. And I know you, Camille, love your fried chicken. And
I do.
yeah, so that was a excellent piece of, fried chicken wing. They had rice, they had noodles, they had sweet and sour pork, they had
Wow.
pumpkin, they had the green beans, they had the bok choy. I mean,
You remember everything.
it just kept coming, like, the table just kept spinning around, and you just kept eating it. And I got sat at a table with a lot of elder people, and they want you to eat. So even though I'm in my 50s, they were all in their 80s, so they thought I was a child to them. So they would put food in my plate, like oysters came, and I'm not a fan of oysters, and so they saw that I didn't take an oyster, and so somebody took their chopsticks and put an oyster on my plate and said, "You have to eat this," and I was just like, "Oh." But
Isn't that something I see that a lot? It doesn't matter what culture you're from. Old
right,
people like to feed younger people. I
right,
think it's really
right,
cute.
right, yeah. So it was just sitting there and just like food after food. And once I thought, okay, that can't be, they can't bring more food out, then they kept bringing more food out and more food out, and it was just a ton of food. So the food at both events were excellent, well worth my time going.
That is the
Yeah, and the decorations were so cute, and it was just, it was just very beautiful.
That is impressive. And you're talking about food, and I can hear your dog just kind of, where's my food? But wait, now I'm gonna have to meet your patients, Dr. Ray. I'm gonna have to befriend them, and be invited to their, the 1-year-old birthday party.
Well, it's kind of, I think that's really, really nice. But you have to be careful too. There's like it, and it's different, I think, for Dr. Ray because of the nature of what she does, right? It's like you've ushered their new family member into this world and help them throughout their pregnancy. And it just, I think, and I think in some cultures too, it gives you like a very, very special place in their family.
Yeah.
But it's also
Mm.
like I have a patient recently who's like super cool and really nice and has really given me the honor of trying to pay attention to what I'm saying, and she's like, "Oh, come hang out with us. Like, come have tea with me, and I'll buy you dinner or something." I mean, it's very nice, but like I can't do that. It gets weird. Sometimes you have to be like, I can't. This crosses a professional boundary here.
Then
Yeah,
what is
I
your
think I failed to mention though, I probably have a little bit of a background connection to them as well. So I probably wouldn't go to a patient's party who was like just strictly my patient, and I didn't have anything outside the office connection with them. So the Indian family, I think we have like family friends in common. We kind of know some of the same people type of thing.
mm,
But they were having the party at a hall that my family relative owns, and they know that I'm a relative of that person. And I think because we're of the same cultural background and religion, and that's why I think that they invited me. I think if I was not that cultural background or have a little behind the scenes connections, then I probably would not have been invited. And then with the Chinese couple, they're currently pregnant again, so she's coming into the office again for baby number 2, and they
oh, we're
happen
coming.
to live in my neighborhood. And so maybe about 8 months ago, I saw them walking, and I was like, "Oh my God, there's my patients!" And so I pulled over and was like, "You guys live around here?" And so I think that I sort of have a like kind of behind the scene connection with both
Uh-huh.
Yeah, like
of
an
them.
outside the office
Yeah, and
connection.
so I
That's
think
totally.
that's probably a little bit more why, because otherwise, I agree, Dr. Foz, that if it was just a patient coming to me and they invited me, then maybe I would be a little bit hesitant. But then also, again, to be quite honest with you, like I'm in a very different phase of my life. I'm in a much I don't want to use the word lonely because I don't think I'm lonely, but I'm in a much more quieter social scene uh, period of my time of life right now, so I don't have too many things going on socially. And so if I were to get invited to something, I think I would probably take them up on it because I don't have a lot of stuff going on right now. If this was maybe when my kids were smaller or when they were in high school and they had soccer and volleyball and all this stuff on weekends, I probably would have politely declined. But now, I feel I'm older, I have the time, and so it's like, oh, sure, I'll come. That's lovely for you to
Wow.
come. Yeah.
So to the listeners of this podcast, just email us at questions between doctorsandfriends.com if you want to invite Dr. Ray to your 1-year-old kid's birthday party.
Yes, but not even just that. If you want to invite me anywhere, if you want to invite me,
No,
yeah.
you know,
no, this is
when I think
I'm
about
sad
it,
now.
I mean,
I'm
if you
really
think about
sad.
it, like 1-year-old birthday parties are actually pretty grand. I mean,
They are, especially I think
Massive.
for certain cultures. So that's why I kind of knew that they would be quite, quite an experience. It wasn't like honestly, if it was like a birthday in their backyard or in a park, I probably would have been like, I don't know, what am I going to do there? But because I knew that they were renting out, halls and hotels, and I knew that they were, going to be a little bit more extravagant, I kind of went for the show part of it, and then with a lot of people, like the Indian party, they had like 400 people there, and the Chinese party probably had at least 100. And
I
so
don't even know 400 people.
yeah, so I could blend in,
wow.
but if it was like a backyard party, I think I probably would have hesitated even in my empty nester loneliness phase. I probably would have been like, I don't know if I want to go hang out in somebody's backyard that I don't really know any of these people. So it was just different circumstances that happened, 1 week apart.
I
Well,
think
also, I think it's different too. Once again, the role that you have as a physician in their lives, it's like ushering their child into the world. I think has a different
Yeah.
appreciation
And
of
like,
it. And a limited role in some ways. You know, what I mean,
right. And they
they're not coming to
introduced
you to talk
me.
about their toe or whatever.
Yeah, they introduced me to everyone as the doctor that delivered the baby. And so like, especially when I was sitting at that Chinese table with all the elderlies, they were all like fascinated that I was the doctor. And then they kept putting, like I said, they kept putting food in my plate. They kept filling my glass of wine, and they kept saying, no, well, have the doctor eat, and they brought like some
wow.
steak dish. And then they were like, okay, let the doctor have first. And I'm like, oh my God, you people, like, I am not anybody.
I think we need to give you like
I-
That
QR
was
code
all
of your
respect.
You can tell
Yeah,
them
I
that you have
do
a
not,
podcast.
I'm just like, you guys are all like, 70, 80 plus. You guys please eat what you need to eat. I obviously have eaten enough in my life, and I'm not starving for food. So I do not need to be piled on the food. But they literally piled on my plate. And then when my plate was so funny, my plate had, because that fried chicken was good. So I had like, maybe, I don't know, 3 or 4 wings, like, the bones, and I had some of the short rib bones like in there. And so one of the elderly women sitting next to me asked the waiter, she goes, can you bring the doctor a clean plate? I was like, you don't have to bring me a clean
That's
plate.
hella
This
cute,
is so
though.
embarrassing. I
They
know,
were
but
taking
it was
good care of you.
they
Like,
did. They took very good care of me. I ate a lot. I drank a lot.
So sweet.
And when my wine glass was empty, like they called people over to fill my glass. I'm like, like I don't drink a lot of wine, so I'm already at 3 glasses. I don't need to drink more than 3 glasses
Ooh-wee.
of wine.
Wow. You need to
Were you getting
invite them to this
sloppy?
pot.
Yeah, because because they kept filling it, and I was like, that's
Wow.
enough, but it was very nice because they were very doting on me. So I did feel kind of special, and I did feel like, like this is a nice, happy occasion. Because again, I would have just been sitting at home watching Netflix by myself if I didn't go. So it was nice. It was happy. It was a beautiful event, well decorated, so, and the babies are all so cute. So you
All
can't.
right. They get a 10. Wait,
That's
we
so
had a
nice.
hand
That
raised
sounds like
over
such a
here.
respectful, such a
Yeah.
respectful
Yeah.
family too.
Yeah.
Very
Yeah,
nice.
and I just wanted to add to it, Dr. Ray. Remember when you all tried to say, "Oh, we're doctors, we just put on our pants like everyone else," and I said, "No, you're
Right.
not putting on pants; you're putting on scrubs." So
Right.
yes, get the doctor a clean plate, get her more wine, get her more food. Yes.
Okay,
That's
because
so
we have a
nice to
celebrity in
hear.
the
I swear to
building.
God, because I get kicked in the teeth every single day. So thanks for even thinking that.
Yeah.
Yeah, well,
So it was.
Dr. Ray, you need to invite them to this podcast, those 80-plus-year-olds, and then we'll have them ask Dr. Foz.
Yes.
Send them to Dr. Foz for some,
I'll be like, I don't know,
medical
but you better slow
questions.
down on the chicken wings and wine.
Oh.
Yeah, because that's all they talk
But it
about.
was good. I'm telling you that I'm gonna have to find out where they order those chicken wings, and next time we all get together, we're gonna have to
Yeah.
get them. So they said somewhere in San Gabriel Valley, but I don't know where that is or what restaurant. They didn't
Well,
name the restaurant.
I'm gonna have to you're gonna have to make a list of your patients, like their first child, and then their first birthday party. That's kind of that can be the new scene, because remember
The new scene.
my nephew, they brought in like food trucks, and I'm just like, whoa.
Yeah.
So what happens when you get to the third child? Now
who
they're just,
cares,
tired.
right?
Oh,
They're
yeah.
like, yeah, who cares?
No. Then
Like,
then it's the backyard birthday party.
Yeah. Well, we have another. I don't know if we have another hand raised here. Go ahead, Moderna.
Oh no, that was a mistake, child. You know, I be hitting the wrong button when I be trying to react.
Well, Moderna's been chatting over here.
I got too excited.
He needs
Pushing all
some,
kinds of buttons.
you know, wealthy friends with, I guess, celebrating their kid's first birthday party as well. That could
Oh
be,
yes, because the first birthday party is always for the adults. It's never for the actual
yeah,
child. I mean, what are they gonna remember? You know,
right?
like, you ain't gonna remember nothing. So yes, I would love to go to the wealthy first birthday parties. All you can
Yeah,
eat. What do you
yeah,
mean? 10-course meal, fried
yeah.
chicken with
Yeah.
wine?
I
Come
mean,
on.
I mean, honestly, like that's part of the reason why I went because like when they sent the invitation and I saw like where it's going to be, and then I'm like thinking, okay, I these people are wealthy, and I think this is going to be quite an extravagant event, and probably with great food, great wine, and everything. So,
Period.
yeah,
Watch.
so I was like, yeah,
Their second kid doesn't get that kind of party.
yeah, we'll
Well,
see,
you know,
we'll see,
who cares?
I
see.
think that's so nice. So I really do that they
The
thought
first are
so much
always
of
the
you
better.
Yes.
Okay.
to
Yeah,
But
invite you
I'm
and to
very
make sure you
touched.
had a
I'm
nice
very
time.
touched, and
Very
I was,
nice.
yeah, I was
That's
very
awesome.
touched that they invited me and everything. And so, and like I said, I'm in the phase of life that I could do it. Like if my kids, like if I had a 2 and 3 year old, or junior high, high school, I probably would have been like, look, my weekends are packed with kid stuff. I can't go to anything. But I'm
but
just different phase of life right now.
that sounds way better than attending a wedding. I mean, especially for us, like, single, no kids. Just I am gonna have to start because
Well,
I
and
don't have
also
any.
the gift is cheaper. Like a gift for a
Yeah,
1-year-old doesn't cost a lot of money. A gift
exactly. They
for a
won't
wedding
remember.
can be
Yeah,
pricey.
you
Oh
are
my
so
god.
right. Oh my gosh, we just, I think, discovered something here that those wedding websites. Forget that. Just go to the.
Instead of wedding crashers, first
Yeah.
Yeah.
baby crashers.
Oh yeah.
Right. Oh my gosh. Okay. Dr. Ray, thank you for the opening our eyes to that. Um, what age range are you seeing women, give birth, like their first baby these days? This decade.
Oh, I mean, it varies, but I think the teen birth rate is dropping, and the late 30s, 40s birth rate is going higher. But I would say majority of my patients are probably 20s and 30s.
Like late 20s, or that's
No,
very
even
different.
early 20s.
It's all over the
Yeah,
place.
All
it's
over
all
the
over.
place.
I mean, I just had a 17-year-old. I know I have two 18-year-olds. Um, yeah, I have a lot of girls who are like, 23, 24 on baby number 3 or 4. So it's all over. And then, I'll have the 40-year-old come in with her first pregnancy. So it's all over. Everybody has different timelines. Everybody has different family values and,
Are, are
different
you
life
s-
paths.
are you seeing an increase for like late 30s, early 40s?
Uh, that demographic is seeing an increase all over. Yeah.
Uh-huh. I was with a Gen Z last week, and she's in her like early 30s, married. So I asked her about the baby thing, and she's like, you know what, I think I'm gonna wait. A lot of me and my peers, are kind of like more interested in waiting until like our late 30s, and I kind of warned her that I'm just gonna tell you, when you hit 35, your OB-GYN's gonna scare you. You will get
Well,
the go
Nope,
on.
well, I
nope,
mean,
because I did that before they got to her.
There you go.
I mean, the overall birth rate across the country and many other countries is dropping.
Mm,
So many people are not having, either electing to not have children or having fewer children. Instead of having maybe the 4 children that their parents did, they're only having their 2 children. Or a lot of them are having just one child. So there's a rise in the only child demographic as well. So, yeah, there's a lot of, I remember just seeing some of the politics stuff and everything. They're trying to, I think part of all the stuff that these um, male white politicians are doing is trying to increase the birth rate. And so you'll see a lot of them talking about that, increasing the birth rate, and probably a lot of the incentives that they're doing are trying to increase that as well.
Hmm.
Yeah.
Wah.
It's life is very hard now for everyone. I
It
think,
is.
unless honestly you're in the top 1% or maybe top 5%, life is very hard for everybody. The gas prices are ridiculous. The grocery prices are ridiculous. Eating out now, I sometimes will take, maybe once a week, I'll go have lunch by myself somewhere just to escape everything that's going on in my life. And I used to get away with lunch, anywhere between $10 and $15 for everything. And now it's $20 to $25. And that's just, like maybe like a cheeseburger, fries, and a drink, and then add the tip, and it's coming out $25. And that's a lot. It's a lot to go out to eat. It's a lot to go out to do stuff. Like I even told my kids, like, when we go out to eat, I was like, you guys, start getting just water, because these beverages now, they're charging like $5 for, a glass of Coke. And that's absolutely ridiculous now. So I'm just like, if you guys are going out with your friends or we're going out together, just get a glass of water and drink your water. You don't need to do any of that. And I'm hearing the kids too, like with alcohol and cocktails, like they're drinking at home before they go to the restaurant, and not drinking at the restaurant and then drinking afterwards, because the cocktails are almost $20 for a cocktail.
Yeah.
We had a staff member depart recently, and there was that everybody got together after work, as for goodbye drinks, that kind of stuff, and single shots were almost $20.
Yeah.
Wow.
I'm
Yeah.
sorry,
I
20
was like,
American dollars?
Yeah. That's
Yeah.
Oh.
insane.
Now,
And,
no, it was $18 a shot. I was like, for a shot? Like, it's not even a mixed drink, it's just a
That's-
shot. You've got to be kidding me.
now,
I remember once upon a time when $100 bill could buy about 30 shots.
oh,
Well, wait, that was 30 shots for one
bill?
person.
you've got
I
to
think it was
Insane.
I think it was
Oh,
10
And
or
I think her
11
name was
shots.
Dr. Ray.
hold
Yeah.
on. Oh,
I was
you
saying,
gotta
I
Moon,
said,
go ahead.
oh, I was saying how I remember when $100 bill could sustain you through a whole weekend of partying and going out
Yeah.
of town. It was
Yeah.
amazing.
hello.
Yeah.
Gas, food, whatever,
Yeah.
party, club. Oh my God, it's so sad. Oh, I don't
Yeah.
want to cry.
Yeah.
So
So
go on, Dr. Ray.
But no, so I'm just saying that life is very hard, and I think people are realizing that. And I think once they've had one child and they realize how expensive the one child is, and how expensive childcare is, and how expensive all the stuff that the child needs, they're thinking they're either going to do this just one more time, or they're going to do it no more times, and then that's it. And some people, I think, who have gotten very comfortable in their life and maybe have not found a partner till, mid 30s or so, are really considering should we, even have children? Because are we going to be able to do the things that we want to do? Are we going to be able to travel the way that we want to travel? Are we going to be able to retire early? Are we going to be able to do all the things that we want to do? Because once you get a child, I mean, these childs probably over the course of your life probably cost $1 million each.
Wow. Well, what's the average cost? Average, just kind of like ballpark of, giving birth, being pregnant here in America.
Well, you mean like
Where I am in the West Coast? I'm in the West Coast.
Are you talking for like medical care?
Yeah, like a woman. Oh, I found out. Like I'm pregnant. Like,
I mean, if you have no insurance, it's probably about $40,000 to $50,000, I would think.
Wow.
Yeah, because
Wow.
all the medical care, and then the delivery in the hospital, and post care and baby care.
Often see people who are
Yeah.
pregnant but don't have insurance. I know
Yeah.
that sounds, but because in a lot of states, if you're pregnant, just
Yeah.
by being pregnant qualifies you for like emergency medical.
Yeah, most
coverage
people will
kind of
get
stuff.
the emergency Medicaid. So once they're pregnant, they can go apply for Medicaid, and their majority are covered. So we very rarely see pregnant women not pay anything, My hospital before COVID, we did have an influx of the Chinese birth tourism.
Oh,
And
yeah.
so they did come and they paid cash. But the hospital worked out deals with them. So it wasn't, that expensive. So I want to say, I think maybe $15,000 to $20,000 that the Chinese birth tourists paid to have their baby here.
Wow. Buy a car or have a baby.
You can buy a car with
I'm about a car
$20,000.
every time.
Yeah. Yeah.
All right. So we're talking about, expense and having a child. I'm just gonna what is the typical cost of med school these days?
400,000.
400,000 for how many years?
4 years.
So
I have
100,000
no
a
idea because I
year?
don't pay attention. After I left, I did not care.
Yeah. Average doctors are coming out with about $400,000 in loans from med school.
Wow. And then,
Well,
go on.
for med school, you have to remember that depending on where you go and where you're from or where you live, like it's not just your tuition costs, it's your living expenses.
Yeah.
Okay, yeah, that's
So
true.
you still have to if you have to move across country, let's say you have to rent an apartment, you have to figure out your transportation, you have to be able to feed yourself. You still have your bills at your electricity and
Your
all that stuff.
Netflix bill,
You
your
all those
iPhone.
things that you have to pay,
Yeah.
so it's not depends on where you go. A lot of it'll be cheaper if you go to a state funded school versus a private university,
Okay.
and where you live, where you might go. Living expenses, I'm sure, in New York City and Los
Yeah,
Angeles and
the big
places
cities.
like San Francisco are going to be a lot more than if you were to go to school maybe somewhere in the Midwest.
Mm-hmm. Okay. We have a hand raised here. Moderna, go on.
Yeah, I got a question. But first, if my doctor got time to watch Netflix and pay for that subscription while they're studying for their degree, throw them away and don't have them see me because I study the book. Watch them books, baby. You ain't got enough time for Netflix. Netflix is going to lay you low and you will not pass. Absolutely not. You watch all the Netflix when you gotten that degree, okay?
Well,
Now,
you know what?
Can I say something about that?
Go on.
And then I'll
I'm
follow.
done with all that. I still keep up with all my CME. I try to be on the edge of things. I try to know what I'm doing. I still ain't got time for Netflix.
girl, really, even now. Oh, see,
But you,
And
now I
that's
would have thought
terrifying.
a
I will
doctor
go
would
my
have had
entire
time.
life and not really have time for Netflix. Let that
Oh my
sink in.
goodness.
that's how
See,
bad
I would
it
have
is.
thought that after the degree you'd been like, okay, now I'm easy breezy. I could, shoot some shit and watch some Netflix. But ooh, child, okay.
Right?
All right. Well,
But
I'm gonna have to
I
start
will
them
I
down.
will defend these students. Medical school is incredibly emotionally draining, and
Yeah.
they require you sometimes, like when you're on rotations, to be there at 5 a.m. and then you're following the doctors around all day, working with the interns, doing everything. Maybe they'll let you go home at 8 p.m.
And they're yelling at you through the whole
and
time.
it's a hard day. It's a hard, long
No.
day. And then you have to go home at 8 p.m. and then you have to read and study, to prepare for the next day. So maybe it's midnight.
Mhm.
So, watching a little Netflix when you have a little bit of time, just, being, relaxing a little bit. It's not taking away from their studies. They're not on it all the time. There's no way they can be on it all the time. It's just, your brain can't be functioning all the time. You can't be constantly learning and reading and doing everything every minute that you're awake. You need some time where you're just staring and not thinking about anything and watching some ridiculousness.
Some
So,
trash.
Mhm.
yeah.
You need a
So
chance
my
to
Then you
show,
have your little
so
decompressed moment.
so I, we trained before there was streaming services or anything like that. I think, maybe, I don't even think we had DVDs or CDs. I think it was,
All right. Don't,
VHSs,
yeah.
right?
Okay, hold
So
on.
the-
Hold on.
okay,
We ain't that
anyway,
old. Back
all right,
that
so
up. Okay,
but
let's
my
no,
show
just
every week
stop
was Sex
there.
in the City, and no matter how hard
Oh,
I
well,
was
we live for a little
working and
Carrie
studying and
Bradshaw.
everything, I had to take just that time to just sit there and watch some mind-numbing, asinine show about such immaterial thing or material things that I just needed that brain to just stop working
Well,
than just watch something.
let me
Well,
share
and
a
also
little.
Sex and the City was life educating. Okay, Carrie
Yeah,
was telling
okay.
us how to
Well,
live
let,
like a
let
New
me
York girly.
But
let me share you something a little about Dr. Ray is that um she would go clubbing with us and go and return back to the campus, and maybe we'd get back like 3 4 a.m. because and guess what, 6 a.m. she gets up and on a Saturday and she is at the library studying while we're still
Period,
all
Dr.
hung up.
Ray.
yeah,
Period. And
That
you
is
know
like
what,
yeah,
Dr. Ray?
crazy.
I'm an engineer. I was the same way.
yeah,
The way I would hit them house parties and be out till
Uh-huh.
2:30 in the morning, and by 7 a.m. I am up in them
yeah,
books learning about thermodynamics and physics, baby. I was
yeah.
doing it, okay?
You had to do that. So it
Exactly.
was it was a it was a
That's
work hard, play hard
crazy.
type of environment, and
That
you made
part.
every hour yours.
Count.
And so
You literally made it count. Yeah.
yeah, and
Oh, but
so
I
for
did have
these
one question.
yeah, for these, just I'm going to say, just for these
Mhm.
students today, a little bit of, let's give them a little bit of grace. A little bit of Netflix every now and then is not going to make them any less of a doctor.
Yes, yes. For the doctoral students out there, y'all go ahead and get that
Yeah.
shared password, and
Yeah.
use the VPN to
Yeah.
fake the address, so that way you don't have to pay for it. But
Yeah.
decompress with your
Yeah.
good Netflix. No
Well,
chill though. Don't be doing no chills. I need you focused on the books. Yeah, yes.
well,
Well, I
But
then
think also
go
what's
on.
not what's not
Oh, go ahead.
recognized in this whole thing, it isn't just academically vigorous, right? It's not just that. It's also emotionally taxing. You have people croaking on you, like, right in front of you.
Mm-hmm.
You're, like,
Mm-hmm.
stuck in these situations where you see people who are coming in the door mangled, or you have to break terrible news to them, or you see their family members, like, crying in hysteria, and, you see little kids that are sick, and there's all these things that are about it, and then that's just the emotionally taxing part of it, like, being the caregiver. Like,
Mm-hmm.
as medical students, and then you move up into internship and residency and stuff, shit rolls downhill, and
Okay.
so you get, abused, harassed, I think there's movements towards to be that's not quite as acceptable, but, I mean, it can be openly hostile. I have been victim of sexual harassment that would have never flown, post
Oh wow.
me the
Yeah.
hashtag me too, like, like, what had happened to me would have gone to litigation in more modern times, and so, yes, you absolutely do need to give those poor medical stu I'm hoping that it's not like that for them anymore, and that they have an opportunity to, be human as well, because that will protect their health, their mental health, and allow them to thrive, and I want them to be good at what they do because I need them to take care of me when I'm old.
Dr. Foss,
Mm-hmm.
walk us through like um to become a doctor. So you take your undergrad, and then what happens?
So, medical school has, depending on where you go to school, and I can only
Mhm.
speak in the United States, right? There's certain requirements that you have to meet. Like, you have to have had X amount of chemistry, X amount of physics, X amount of math, like X amount of whatever. So you have your prerequisites, in terms of, like, completing that basic science knowledge, and it does vary between schools. Like, where I had gone had some additional requirements in terms of advanced chemistry, but since I liked those classes anyway, it wasn't, like, a big deal. Not
Ugh.
all, like, yeah, I know. And then, notice I didn't say calculus in those things. Perhaps. There was no linear algebra that I had to worry about that much. So then you have to take a test called the MCAT, and that's like an admissions test. And
Okay.
then so there's like that's a test of basic, science knowledge that you gather in your university years. Some medical schools require a degree. So where I went to school, I had to have a bachelor's degree. Some do not. As long as you have completed your prerequisites and have met their requirements, then you may enter. Um, don't Okay, I see those shocked little faces. So, they don't, that doesn't mean, like, you can just be 20 years old and be done with that. I mean, a lot of the prerequisites are years and years of university, so it's not like you can just go in and be done. And, and then are selected for admission based on your application, and they'll want like interviews and all kinds of stuff like that. And it's just like going to university. Like they'll look at what you do in terms of like, did you do anything extracurricular, and where do you stand in your academics? And so that's basically kind of how it is.
Yeah. Just to interject, we actually know someone who only completed 3 years of college and then applied to medical school and got accepted without the bachelor's degree. So,
Wow.
yeah.
Wow. All
You
right.
know her. You know her.
I do.
You do. Yeah, we went to college with her.
Oh. All right, we'll talk about that later. You'll
Okay.
have to remind me who
Okay.
she is.
I'll
It's not
remind you
me.
now.
It's not me, because I
not
did
Dr.
have to
Foz.
finish my bachelor.
You had a bad experience at her wedding.
Okay. All right.
Okay.
All right.
All right.
Oh, okay. All right. Well, like I want to transition here, this is kind of go on, Moderna.
Oh yeah, I have one last question.
Yeah.
So y'all were talking about the cost of med school being the 400,000 or whatever, but I'm ignorant to med school stuff. I will be the first person to admit that I'm very ignorant. But when I went for my doctorate in engineering, I was able to get like scholarships and like funding and all that good stuff, research assistantships and all that stuff. So I don't, is it the same for medical school? Like, do med school students actually end up getting scholarships or research
They
assistantships?
can. Absolutely.
Oh, okay.
Yeah, they can do that. Yeah.
Isn't there like a program where, the government helps you, and in exchange, when you become a doctor, you have to work X amount of years?
Yep.
And
There's loan forgiveness programs with that you can do after school. So like you can agree to work in underserved areas for X amount of years, and they'll pay back X amount of your student loans while you're also working, making your salary or whatever. Those are, it's just agreements to help bring physicians to areas that need medical services. And then also some people do the military.
Okay. Well, so before we transition to kind of another topic here, but related, so Dr. Foss, Dr. Ray, what can you tell like young people, in high school or maybe early college who want to pursue to be a doctor, but maybe don't have the means, or kind of their fears?
Well, it's expensive, but I mean, it isn't unreasonable when you look at schools that you're looking to you don't have to go to the most expensive private university to have a great education.
Yeah, there are plenty of state medical schools and different locations that can maybe be a little bit more reasonably priced. I went to a state med school, and I took out loans, but it was very reasonably priced loans. Dr. Foz went to a pricey, uppity private school
Uppity.
away, and ended up with a lot more loans. Uppity, spoiled children, uppity, and they, no rivalry, nothing. I'm not jealous, nothing like that. Ended up with, I don't even know how much, 2 times, 3 times my loan, something like that. So
probably,
yeah, you can make choices and decisions, go to a state undergrad, you don't need to go to, an expensive out of state school. There are plenty of doctors who have taken the path where they've gone to community college for 2 years, saved that money, gone to finish off their degree at a 4-year university, at a state university, and then gone to a state medical school. So you can do it for, potentially less. And a lot of people take time off in between college and med school and work and save that money, move back home, get a job for a little while, save some money. Once you have, 40, 50,000, whatever saved up, then you can go to med school, take out loans for the tuition, but then, use your money to pay your living expenses. You don't need to live in the fanciest apartment, and you don't need to DoorDash all the time. You need to be put on a budget. And a lot of people nowadays, especially these young, Gen Zers or whatever, have a hard time with budget, and they just want convenience. My daughter is one of them, sitting at home, and she, door dashes some food, and I'm like, why can't you get off your lazy ass and go get it? It's only like a 5-minute drive, and now what? You paid $10 extra for the DoorDash to come to you when you could have gone and got it. You have to think like this, and that. All right, fine, it's one time, maybe you do once a month, pay for it, the convenience. But these kids are door dashing, to their dorm rooms almost on a daily basis. So anyway, that's a whole other topic. So anyway, so you can be frugal and you can go to med school and you can do it. So if your goal is to go to med school, but you're worried about the cost, there is a way you can do it. You just need to have the mindset for it.
Yeah, I agree with that. I mean, where there's a will, there's a way. And, there are scholarship opportunities out there. You have to look into that, and kind of have a plan, and there isn't, I'm going to say it, I don't think there's a medical school in the United States that I think is like crappy. Does that make any sense? I don't know how you feel
Wow,
about
that's
that, Dr. Ray. I
that's
mean, it's
pretty
not
good
like,
to hear.
That
it's
feels
going
like
to
a
an
bold statement.
Yeah.
well, I think there are some that are better than others. But I do think, like, I mean, if you,
I mean,
these
if you
schools are
match into a
accredited.
residency, I can't. I mean,
Yeah.
I'll tell you, like, I have maybe 1 out of 100 patients ask me where I went to med school. So
Nobody
even if
cares.
you go to, I don't know, some little state school in the middle of nowhere, and or a little private med school in the middle of nowhere, and no one's ever even heard of it, people
These
don't
are
really
these are
ask.
accredited, like there
Yeah,
isn't a med school in the United States that's not accredited. So like
yeah.
because they have to meet standards, to meet training standards, to meet certifications for boards. So it's like there's these large levels of supervision, if that makes any sense. And so there isn't a crappy school. I mean, I'm sure there's some that are better than others, but if you went to med school in the United States, then yeah, you got a brain, you're fine, and then a lot of
Okay.
times it's like luck at the draw,
Mhm.
Right.
Well, you know
So
what?
that's not the only thing that determines, what kind of physician you are. And I've seen doctors that have come out of really great schools and they're not very good at what they do. So, it's not just that.
So it's the person, not the school. And I think this is a great message in time for all these graduations that's happening right now. So, I wanted to transition, speaking of everything that we talked about. I want to bring up this lady named Cheyenne Bryant. Auntie, you want to say something about this whole, um, and we'll play a video.
Absolutely. And Moon, please feel free to jump in as well because because she and I have been talking about this offline as well. But so long story short, there's someone who goes by the name of Dr. Cheyenne Bryan, and that's really important to note. The doctor is important to note because her credentials have been called into question. What has called them into question was the fact that she was, publicly giving out advice that, a lot of therapists seem to go against, they felt that it went against their teachings. So they were like pretty much saying, "Girl, show your credentials. Where is your degree?" Like, and her excuse was, "Well, my school closed down, and I wasn't able to, obtain it, and I was busy." But I just gave you the short version of everything. But she just recently, and what you're seeing on the screen now is her defending, her not having to show her medical degree. So there was a clip she was talking on a podcast recently, and a lot of videos have been released afterwards pretty much saying, okay, yeah, this is not matching up. I don't think she is a credible doctor.
So I'll play
Well,
a little bit of video and then we can talk about it.
hold on.
Yeah.
Just not to be a killjoy here.
Yeah. No.
Anybody can call themselves doctor. I mean, look at Dr. Dre, right? Pretty sure he didn't go to med school either. Just saying. And then the other issue is I think her thing, from the little clip that I took a look at, I think she's a PhD, not an MD doctor, right?
Yes.
Okay, so that's a little different. That I can't really comment on, but I mean, anybody who has a degree should be able to produce evidence of that
I
degree
mean, where's your
and give it to an
diploma?
accredited
Everybody has
program.
their
Yeah.
diploma hanging on their wall or on the wall of their
Actually,
parents'
I
house.
don't. I don't know where my diploma actually
Oh,
is.
period. The level
Lord.
of passion behind this. Oh, we about to get in.
Lord. I mean,
But you're saying everything everybody else is saying.
yeah.
If you work to get a PhD,
You should have a picture of it.
you
Where's
have
your picture of your
dissertation.
graduation?
Your
Put
look,
a picture of you at your graduation.
Dr.
You should have
Ray.
that.
That is what everyone is saying. Like, I'm sorry. If you can't even do the bare minimum, then you're lying.
If someone asked me, I could produce all my stuff in a minute. They're hanging on the wall right behind me.
There you go.
I'll just snap
Well,
it.
the thing is,
Should we
at least
watch
for
the
us,
clip?
like credentials go deep. Like if I
Yeah.
can't cough up my diploma, you can contact the universities that I went to. They'll tell you. There's like state medical boards that have information on me. Like there's like these huge paper trails for physicians because of
Yeah.
consumer protections, right?
But I mean, maybe not with a
PhD is
PhD.
different.
Yes, but where I don't. Okay.
But they should be able to produce
Yeah,
credentials. I mean, if
let's
you're
play
applying
the
for a
clip,
job and you say,
right?
"Oh, I have a PhD in, you know, chemistry or something," okay, and you're going to be an industrial chemist. Okay, let's see that degree. You have to cough it up at some point.
Yeah, yeah. Let's play the clip, and thank you to TMZ and AT&T, who are not sponsors of this show, but they are sponsors of the content we are playing.
But with the questions that are out there, why not provide the proof of your degree? Why not?
Well, a couple of things, right? I have multiple degrees, and my thing is that my proof isn't something that I have to prove to individuals. My proof is already within my credentials, my degrees, and also more than just my titles, it's in how effective I've been. All of my sessions have been live for the most part. My sessions with Nick Cannon, Cam Newton, Shannon Sharp, B. Simone, they have all been for the world to see. Right? So no one knew who Dr. Bryant was prior to seeing all of my sessions that were live. And they deemed it, as well as I did before they did it, they can't validate me, I validated myself. They deemed it as my work being effective. I am effective at what I do. I'm educated and I'm successful in my lane. And I'll land on this. I created my own lane. And so a lot of times, Marissa, when people say that you created something that maybe they couldn't, admiration turns into envy. And you got to be okay. And you got to be okay with that.
Yeah,
And
politician.
But I think, and I've gotten
She
this
should be a
question
politician.
from many viewers, and I owe it to them.
You
in
do.
service to
Absolutely.
them. Why not
Answer the question.
swap doctor from your name if you cannot bring forth the doctoral degree?
So I've already covered this, right? And we're here obviously to talk about my new book. So I've earned the title. I have multiple degrees, and I'm not going to prove anything to anybody. And we're going to leave it just as that. Yeah.
Dr. Cheyenne Bryant.
Baby, Dr. Cheyenne Bryant.
And that's what, and you're standing by that.
Standing by it. Yeah, because I earned it. Absolutely.
All right. Well, thank you.
No,
thank you. I know you're going to hang around. And
I want to thank you for asking the hard questions.
Well,
All right.
No. I mean,
Dr. Pepper doesn't have any credentials either, but they're Dr. Pepper.
I mean, why be so, she's so evasive about it. Like,
She's
if
very
you have it,
evasive.
then
She's
do
not
it.
answering
Then
questions.
why?
And
Look,
It's like when Obama, everyone said Obama wasn't born in Hawaii, and he's like, here, assholes, here's my birth certificate. Like, why, why be so evasive about it?
Because she don't have it.
Right.
then
This is how
you answer questions like that. You start off, you basically just start talking about something else, like, let's get off the topic. And
then you just
I
start
stand by
saying,
this and whatever.
I don't have to prove it to anyone. I know it. I don't have to prove it to anyone. And that's it.
It doesn't exist.
Yeah. Yeah, she definitely doesn't have it. I mean, if you I'm sorry, to get a PhD, it's like 3 to 5 years. You would be very proud of that PhD, and you would show it
100%.
off and tell people that that's what you have. And like I said, most people have it displayed in their professional offices, or they, somewhere their parents probably have it or something.
So, Auntie, is she in the mental health field? Is this what this is about?
She is indeed, yes.
Okay, so that's like people saying that they're like, there's a difference between like a nutritionist and like a registered dietitian. It's like anybody can be a nutritionist, but a registered dietitian went to school and has a degree as a registered dietitian. So maybe it's one of those kind of things, and anybody can call themselves doctor. It doesn't, but
She's supposed to. Technically, I think she should be a life coach, which she says she does, because she doesn't have a licensure. So, which makes me think she doesn't even have her master's degree, which she says she does. She says she has multiple degrees, but from what I gather, what I gather from everyone who has got a PhD, they still talk to people on their panel who did all the review. They have their dissertation at reach, almost,
Yeah.
if not on their phone. They have pictures. They have the diploma. They have all of these things to provide at a moment's notice because one, they're proud. Two, they don't play about it because it's such hard work and they had so much trauma around it that yes, you're gonna see this. So for her to be so evasive about it further lets me know that really she's just a scammer who wants to hold herself at a higher standard, which I think no one would have had a problem if she came out and said, I'm the baddest, most whatever life coach on this side of, the West Coast or whatever. And people would have been like, fine, that's okay, do what you do. But she also said she didn't want to hold a licensure because, she didn't want to be bound by basically the ethics committee or
ethics.
The ethics of
we don't
it.
want you to be bound by ethics or anything like that.
Yeah. So that was also another red flag. Like, come on, lady. And so it's just.
So is she, before this controversy happened, was she like famous and well respected?
No. She came out on one particular podcast. I think she came out on Cam Newton. He was a quarterback football player. She came on his
Panthers, for the Carolina Panthers.
Yeah, and she came out on his podcast, and then she went to Shannon Sharp, who was another football player's podcast, and then this other girl she named Nick Cannon. Oh, Nick Cannon was also another one. And she got a lot of traction behind that. And people became interested because she did make valid points on these people. Like, she did make valid points. But then when she kept being out there, some things that she was saying were a little questionable to people who actually work in the mental health field. Like, hey.
Like,
if you got a license, you're not supposed to be doing that. Like, what you said is pretty harmful. Like, wait, whoa. And then we've headed down this rabbit hole of like, well, it doesn't seem like you really have a doctorate or, she's one of those people
and
that
I can attest, Moon, you ain't lying because even though I don't have a PhD, I was a doctoral student at one point in my career. And along the way, I got my master's degree. And that university gave me a small laminated card that shows my degree on top of like the actual diploma that's in a frame and definitely is in my house invisible for people to know that I'm an educated bitch. But I have this small laminated degree. And that one stays in my wallet because I dare someone ever try to question if I graduated from this institution when I'm out in public. I will most certainly pull out that laminated degree and be like, now read and try again.
Yes.
And I also think, and maybe I'm going to be wrong, but I don't know what kind of background she comes from, but I'm sure her family would have been incredibly proud to have had a child.
You better wake that up, Dr. Ray.
I'm sure that they would have copies of her diplomas or whatnot. And, I assume you can go and find that from her parents' house. They should have that or something.
Or
her grandma would answer the door and say, "Oh yes, she went to this school."
I mean, I was at that first birthday party, and I had all those elderly people around me. If I gave them a copy of my diploma, I'm sure they'd put it all up in their houses and be like,
"The strangers."
Yeah.
People of color, of cultural outside of Caucasian.
Mayonnaise.
Yes.
Yeah. Outside, we celebrate education to the highest of levels. Like, family don't play about that. If you're the first person, if you're the 10th person, they're happy.
Right. So I would think her mama would be having a big picture of her in the house saying, there's my daughter in her PhD regalia. And that's her thing. I mean, I would do that for my child.
Oh, totally. And the thing, though, to remember is, notice she's really evasive. And, like I said, that's when you don't have the answers to the question, you just deflect it. But any publicity is good publicity, even if it's bad publicity. So look at us on this little weekly friend get together that we have. We're talking about this person that I don't even know.
So
I think it may harm her bottom line in the future, which I'm okay.
And you don't even need to know her because she ain't no doctor.
Yeah.
And
So as doctors, how do you feel about things like this when these happen?
Well, this has happened in the medical community too, where they find out, people aren't doctors all the time. They find out surgeons who did surgery down in Florida for years all of a sudden aren't doctors at all. They came from whatever country they came and said that they got their degrees in that country and whatnot. So this happens all the time. People are fraud in every level of
Wait.
education.
I don't think there's. I think there's fraud in every level, but I don't think there's like all the time. There's people who are operating on other people that.
No. I'm not saying all the time.
That's not common.
I mean, this has happened before. So this happens and has happened in the medical community. But it's very simple to just put this down and just be like, here's my credentials and that's it. Move on. So it's very suspicious, and I'm going to vote that she probably just has at minimum a bachelor's degree and is trying to tout herself as something more.
The thing that's different though for physicians or dentists or even licensed social workers, optometrists, veterinarians, like anybody in the medical fields is usually in most states that you live on, because you deal with the public and make decisions with them, it falls under the Department of Consumer Affairs and Consumer Protection. And so we in the medical field, nurses even, like, you can't just come out and say, oh, I have a nursing degree, and then you're all of a sudden a nurse, and even though you never were, and then that's what happens. Like, when I went to medical school, I went to an accredited university, for that. And then when I went to residency, residencies are also accredited, and there's communication between the residency and my school. And then when I'm up for licensure, there's like part of me getting my license required a lot of paperwork to be done by my residency program. It wasn't just me like filling out an application and hoping for the best. Like, I mean, there's all these things that have to happen. And so I guess I would want everybody to know is like in the medical professions and the helping professions that deal with the public, because of the Department of Consumer Affairs that are involved, like there's a lot less danger for this. Now, PhDs, you can get a PhD in whatever topic, if you're a PhD, like I said, like, in some degree in psychology or one of the harder sciences or in mathematics or something, you're not necessarily providing services to the public. And so there isn't that level of scrutiny, if that makes any sense. The Department of Consumer Affairs is not involved.
That's interesting. Moderna, you have your...
Yes. Okay. So y'all are bringing up such good points, and I have two things to address. Well, three. Dr. Ray, you are spot on, honey, because when we went to this lady website, she only claimed in her About Us that she actually got her degree from Cal State Northridge as undergraduate degrees, which is what you had, so accurately predicted, because you are an actual doctor, so you understand. Unlike her, everything else she mentioned that she was pursuing things or all the other things. And then the other thing you were saying, Dr. Foz, is you're right. You could get a PhD in, some specialized field, but if it's not consumer facing or you're not affecting the public in any way, then it might not necessarily involve, the legalities of like the state boards and all that other stuff, right? Because
it doesn't involve the public. It's
exactly.
Not public safety.
Exactly. Because like you could get a PhD in engineering, but if you're not actually signing paperwork or signing off on documents that affect the public, then you don't necessarily need a license, or something like that.
Right. You don't need to be vetted so much, Well, I mean, and that's, and I think that's where a lot of fraud does probably happen, is because it doesn't involve, these more, like I said, there's all these handshakes that happen, the communications between things. So that's probably where things fall between the cracks. And that's unfortunate. I wish, once again, any publicity, even bad publicity, is still publicity. Because if she's selling a book, here we are talking about her, and there she was on a show. And so she may not have credentials, but everybody's talking about her. Everybody knows who she is.
That book is definitely going to get purchased, right? But
so don't talk about her, because then she'll go away.
Well, people are returning the book.
Okay. Yeah. But speaking of the fraud, though, because y'all are bringing up a good point, like it can happen. What is the best way for consumers or patients like me to understand whether or not my doctor does actually have their credentials. Because I think it was Dr. Ray that said it earlier, was like, hey, most people aren't asking their doctor like where you get your degree from when they're coming into the office. Now, I know me personally, I'll look them up to see like, okay, where they got their degree from, but everybody don't
Everybody's
always
different.
Google,
Yeah, everybody's different. So like I've had patients, like I had somebody come in once and like basically read me my resume back, and I was like a little
Wow.
scared. Like I was a little like, are you like some crazy stalker? Do I have to call security? I'm like, how? Like, yeah, that's where I went to school. Yeah. And then this patient's like, okay, so let's proceed. And I was like, all right, well, I'm glad I've passed your
Wow.
muster. It felt kind of, then it
examination,
felt,
your
well, it felt a
cross-examination.
little like a little paranoid. and then it felt a little like, oh, now you're good enough to talk to me. Then I'm like, you know what? I got tons of patience. You can hit the road, pal. Like I'm not here to
Yeah.
impress
Wow.
you. I'm here to do what needs to be done. So I kind of don't care too much about that in some ways. But your doctor can be vetted. You can find out where they went to medical school. You can find out when they got their license. That's through your state medical boards. None of it's a secret.
Okay.
None of it's a
Okay.
secret. None of this can be hidden. So none of
And
us.
if they're prescribing you medication under their name, they've already been licensed and vetted. So
Right.
So so they're real.
Yeah,
So
but
you
if
just
you
search the
only
state
want to
medical
see like,
boards.
like Ivy League educated physicians, then once again, seen great ones out of that and not so great ones out of that. That's your business and that's your own biases. Because
Sure,
I've
'cause
met
I don't give a
great
damn
physicians who
about
came out
Ivy
of
League or
programs that
not.
are smaller and and all this stuff, and they're I've met a lot of physicians that are foreign educated, amazing physicians, amazing.
Yeah.
Yeah, no, I don't give a damn about the Ivy Leagues and shit. If anything, I think they don't care about me, so I wouldn't be looking for them like that. No way.
Yeah, so you just dropped a topic here. You come from abroad, you want to move to the US and become a doctor. What do you have to do to become a doctor? Because, I'm from the Philippines, and a lot of our very good doctors in the Philippines come here and they're nurses.
Yeah. You
Well,
have to
if they have their medical degree in that foreign country, then they have to repeat a residency program here. And
So they have to go through residency. Okay.
and once
Yeah,
they've
so they
completed
they
that,
have to right, you have to take, I think, a special test that's designed for foreign medical grads, and then you still have to take the medical licensure tests, the USMLE testing, which is a 3-step process. So, um, whether and then it kind of depends on getting into a residency, and that might be where some of the problems come up, because residencies are going to want a certain level of knowledge understanding, and so may not, and I can't say for sure, but you may not have priority in those things. And then also there's weird stuff about that, like I don't necessarily think some of it is because the quality is oh so different. I mean, there's certainly even differences. So just for a little bit more background, like there are, even in the United States, like a lot of regional differences on like medical knowledge.
Really?
That are not based on poor exposure or being not educated. Like it's just, so like people who practice and live in the Northeast are going to be a lot more comfortable treating and identifying Lyme disease than physicians who might be on the West Coast, where you don't really see as much of it, like somebody in like Seattle, for example. Not that, so there's a lot of like,
Oh, that's
on the East, if you're
interesting.
from like Connecticut, you know how to handle Lyme disease like yesterday. Like if you're from Seattle, you might be like, oh yeah, I remember reading about that. Like there's regional differences in some of these things, believe it or not. There's regional practice differences in a lot of stuff in the United States, and it doesn't mean it's good or bad. It's just how things go there. So there's going to be some of that, for training internationally, like I think physicians who might train in places where things like dengue is a lot more prevalent, like in a lot of the tropical regions of the world, are going to be a little bit different about that than us in the United States. I'll be like, oh yeah, dengue. Oh yeah. Like, I mean, we don't see that, um, I mean, we do, but not to the same extent. And so you have to go through this whole process though, so to make sure that there's adequate, everybody's trained to the same level. I think that in every country, like if I had it when I was in residency, I had a colleague of mine who decided to practice in Latin America. This person was not of Latin American descent, but spoke the local language fluently, just because they wanted to, and wanted to go help a population that was needed the assistance in a underserved part of that country, right? So she wasn't going to like a capital city or something. She wanted to go work out somewhere where people really needed help. But with, graduation from a great medical school and an accredited, residency with, good skills and everything, this person still had to go through the accreditation for the local country that she needed to go to. They basically put her through the same ringer.
Oh, wow.
So it's often, I think it's just like, well, you didn't train here, so, we need to make sure that you meet these standards. And then I think people sometimes just get snotty about stuff.
Wow. I mean, I'm sure in your field, I'm in tech, so we don't really have that kind of like layered hierarchy. But in your field, it is, coming from academia to the field. You guys have this
Yeah,
hierarchy.
it is. It is. It's sort of unfortunate, and it's I think it pigeonholes some people who don't deserve to be pigeonholed, and I think it elevates some people who don't need to be elevated or should not be elevated.
Yeah.
But and then I just feel like, whenever you suppress something good, you suppress something good and whatever comes from that. And it's hard, and it's interesting too because there's like, oh, there's such a shortage. We need primary care, primary care. Um, well, yeah, but nobody wants to go into primary care, so when you bring these physicians over, they also don't wanna go into primary care because it's a lot of work and not a lot of pay. Don't ask me
Really?
how I know.
Well, I'm gonna ask a question in regards to like certification and licensing and whatever, that you doctors have to go through. Um, I'm gonna ask like the differences between like a DO, GP, like all that stuff. What's the difference? Like internist, like, for us, like for primary care.
Well, a
Well
DO is a doctor of osteopathic medicine, and they've gone to a osteopathic medical school. So,
What does that mean?
so from my understanding, so there's two different types of medical schools. One is basically like the MD, which is a medical doctorate degree, which are
Yeah, we're called
majority.
allopathic physicians.
What?
Yeah.
Say it again.
Allopathic.
Yeah.
Okay.
And so those are the majority of the big name schools. Harvard Med School, University of Michigan Med School, all of those big name schools are allopathic MD schools. The osteopathic route, from my understanding, is they teach them and practice more musculoskeletal treatment options. They focus more on the muscles, ligaments, joints. They learn how to do manipulations to help with certain pain issues, and they spend more time on that type of studies. So that's my rudimentary understanding. So I don't know if Dr. Foz has a better.
Dr. Foz?
I agree. There's a bit more of a focus on a few other things that are tied to like musculoskeletal issues, but it's not like their entire training is focused on that. It's just kind of like in addition. And then there is, from my understanding as well, there's a bit more of an emphasis on primary care in DO programs.
Yeah.
However, it is the equivalent of an MD degree.
Right.
It is not inferior in any capacity.
Right. They learn all the same science and everything that we need
Same
to
training,
learn.
same testing,
They
everything.
do stuff in addition to what an MD does, and they learn more
Right.
of
And they can be specialists, they
manipulations.
can be primary care physicians. Think of them as the same. It's just that because it's less common and less popular that people don't always know what it means. And a DO is not the same thing as an OD.
Ooh,
An
what's that?
OD is an optometrist.
Oh. Okay.
My partner,
completely different.
My partner is a DO and does the exact same thing I do on a daily basis. Yeah.
Okay. So for patients that are looking for new doctors, like how do we
I
choose?
would say MD, DO are equivalent. You don't
Then
need to
why are
choose
they different?
because I don't know, whenever the med school started or whatever happened way back in history or something, somebody decided that, the medical training that MDs were getting were maybe different than what they wanted to teach. And they taught them more of these musculoskeletal manipulations and more of like a whole body treatment in addition to the medical science. And so they started the first DO school, and don't ask me any of that history. I don't know it, but
I don't know
they're equivalent. They just learn and focus a little bit more on different aspects, but they are equivalent to everything. They go to the same residency programs we do. They do the same work we do. Like I said, my partner, who's in the next office next to me, is a DO, and she does exactly everything that I do.
Wow. So there's an OB-GYN DO, blah, blah, blah DO, like a DO version of...
Yeah, they're in every specialty. They're in every
Okay.
specialty. I know a general surgeon DO. I know an internist DO. Like they're we don't
finish
care.
their training and they go into they apply to the same residency programs that we apply to.
Okay. And then do you guys have like annual recertification of stuff, whatever? Or every so many years you have to be recertified?
Depends on your specialty and what you do. Some specialties are, and it depends on when you trained. There are some, and when you completed them. So when you say certifications, it depends if you're board certified. There are physicians that are not. They're not board certified or board eligible. Those physicians are generally considered general practitioners.
Wait. Okay, so there is board certified and non-board certified, but they're doctors? Like, is that what you're saying?
So that's different than licensure.
Okay.
So when you finish medical school, or to be fully inclusive, DO school, right?
Okay.
Once you finish that and have successfully completed that program and you have a certificate, like your diploma, you can then be addressed as doctor. So you're Dr. whoever, because you finished your doctorate degree. Now, what you can do with that doctorate depends on what you do after that point. So you then have to finish an internship, which is postgraduate training. It's
Okay.
typically a year. It could be in whatever, but it's usually kind of general. And that once you successfully complete that, and like it's not like you go, then you take a test and then you're done. Like you have to spend a certain amount of hours doing X, Y, and Z. And then your program has to certify you for your state medical board. And then what happens is once you have successfully completed that and finished all the testing that's done on a federal level, so there's 3 parts of the United States medical licensing exam. One part, 2 parts of them are taken in med school, 1 part at the end of your residency. Those are big, federally kind of managed exams. Once you finish those exams, then you apply for your state medical license. You can apply to wherever you're living or where you might be living or whatever the situation is.
Wow. And
then
is
you
that
get your medical
expensive?
license. So then you're granted a medical license. That's a multi-month process, right? I'm sure everything is streamlined now because everything's online. And you get your license to practice medicine. Now you can set up shop somewhere. You can say this is Dr. Foz's office or Dr. Ray's office. You can write prescriptions. You can order things for patients. You have full scope to practice medicine. I have a medical license. My license, just like all physicians' licenses, is a license as a physician and surgeon. So that means that I could do your brain surgery.
Really?
Now, whether you would want me to do that, that's a whole other story, right? So just because you can doesn't mean you should. And so your license allows you to do everything that a physician does. Then board certification is on top of that. So board certification is you then finish a residency in a specialty, whether it's family medicine, internal medicine, pediatrics, OBGYN, general surgery, ear, nose, throat surgery, ophthalmology, whatever ologies, right? Then you have successfully completed that program and do whatever you need to do. Like for me, for my specialty, I had to then take, just like most, I had to take a board certification exam and meet their requirements for whatever. And then once you do all of the things, now you are board certified. So you're a physician, but you are specialized. Now you're certified to be specialized in whatever that is. So like for Dr. Ray, she's a board certified obstetrician and gynecologist.
Ooh, so that's what I gotta
Some
look for,
specialties,
board certified.
so some specialties you only need, and I don't think this is the trend as much. Like I know definitely not in my era, but like you only need to be board certified once, and then that was it. You didn't have to take the exam again. You had to now you still have to do continuing medical education hours. So like the state, wherever you're licensed, wherever your state medical board is that grants you your license, that board will then determine what your continuing medical education requirements are. You have to do X amount of hours of CME. You have to submit that proof to them to continue to maintain your license as active and current. Special board specialties will want more than that. So what my state says and what my board says are different. So whatever my board accepts automatically satisfies the state because it exceeds the state requirements. Does that make sense?
Yeah. Wow.
And then you do have to maintain it. Now I have in my life experience, I had a partner who was a different specialist, and she was significantly older than I was, and she was board certified, but she only needed to take her board certification exam once. Like basically, in her time of training, once you did that, that was it. That doesn't mean regulations and rules and monitoring doesn't go on. It just she doesn't have to take a big test. I still have to be tested every X amount of years for
Yeah.
whatever I do.
Wow.
So that's the difference between that. Now, so that's when we were saying that you have physicians who are general practitioners. That's different than primary care or general medicine. These are general practitioners. Sometimes, like one of my old colleagues, her dad was an emergency room physician, but he's an older dude, like had been doing this for like, 40 years or something. He was not board certified. He was just a GP. Like he didn't finish a residency, but he did this at a time when there was a lot more flexibility of this. I think in generations past, like as long as you got your license and you can kind of do whatever. And then so even though he's done emergency medicine for 40 years and was good at what he does, if you really looked at what he technically was, he was a GP doing emergency medicine. But that's not a bad thing. That's 40 years of great experience that you don't want to throw away. And just kind of tied to board certification. So people think, okay, well, I only want to see board certified physicians. That's probably what you're going to see a lot of for this reason. For insurance networks, a lot of insurance networks have requirements that their patients have to be seen by certain
Oh.
types of physicians. And so if they're in a huge network, they're probably been vetted pretty well, or at least are, there's requirements. Like every time we turn around, there's some sort of requirement.
Wow.
So
I mean,
you can't hide. It's not that easy. Like when they talk about like what Dr. Ray was talking about, like somebody who's not a surgeon performing surgery, absolutely those things happen. But it's like, how did you get through so many layers of this? Like I don't. Somebody was sleeping on the job. Like what that basically tells me is whoever did the credentialing at wherever they're at was asleep and didn't really do the credentialing.
wow. Dr.
Like
Ray,
for me
can
to
you
get I'm
yeah.
just gonna add one thing. Like for me to get a job somewhere, like I can't just like, okay, I don't really like where I'm working, so here's my 2-week notice and I'm gonna go work over here. Bye. Like it can take months to get credentialed for a job because they have to track down all of these things.
Wow.
It's not unusual for it to be like at least a 90-day process.
Well, wow, that's overwhelming. I'm overwhelmed.
I hope it made some sense.
Everyone got quiet.
No, because I'm trying to process everything. Like you said,
Yeah.
that was a lot.
It's a lot.
Did not realize all that complications behind the scenes.
Haha, yeah, I know. I'm in school to be a therapist, so I know I have to do all this extra stuff and licensure and blah blah
Yeah,
blah.
because
And
your consumer
Facing.
protection agencies are going to want to make sure that you're not, out there to fleece the public. Like, I mean, even contractors have to go through the consumer protection stuff. Like, I mean, anybody who deals with the public like that, they don't want people getting like
Do you
taken
guys have to do
advantage.
drug test?
Depends on where you work, actually.
Okay.
but also California is probably one of the strictest states, right? To get your licensure, and they tend to require more for a lot of people. Is that?
Every state likes to think that they're the strictest. New
Oh.
Yorkers will say that about New York. Floridians will say that about Florida.
No, Florida's a
And
lie. They ain't got no damn restrictions over there.
Now, I knew someone who knew someone. Um, an anesthesiologist that was a drug addict. Is
Well, anybody
that
could be a drug
common?
addict. That's well.
Right? I mean, for an
Well,
anesthesiologist,
I
like
don't know
that's
if Dr. Ray would have anything to say about this, but
Dr. Ray.
like when I was in training, like the stories are always about anesthesia because they're around all of these controlled substances, like they're
Okay.
administering a lot of stuff. And so, you give the patient a little and you give yourself a little kind of stuff. I think to say that anesthesiologists are at risk and anesthesiologists are shady or whatever is anesthesiologists have a really, really hard job. They're
Yeah.
really, really smart doctors. Like you can't just be anybody can be an anesthesiologist, not at all. And I think that also to understand that we as physicians are not that different than everybody else. We have the same problems. There are addiction problems,
Mm,
there are health problems, there are financial problems, there's interpersonal problems and divorce and mental health problems and all those things that come along with being human.
mhm. Now, I wanna ask Dr. Ray, I don't know if, Dr. Ray, can you do brain surgery on me?
I don't think you
I don't think so. I would be just as clueless as anyone else. So don't ask me that.
like Dr. Ray
I
would
could
be a
probably do
better
some abdominal surgery stuff, but I can't go into the brain. The brain is, I mean, it takes neurosurgeons 7 years to learn how to do that. There's no way anyone can do it.
Wow.
Yeah, and, like, I have no business doing, like I mean, I've
Yeah.
done surgeries and stuff, I've assisted and all those things, but, like, I have no business doing, like, any surgery. I have no business delivering a baby. Like, I trained to do it and stuff. I could probably do it better than the average Joe on the street, but, like, that doesn't mean I should.
Mhm.
Yeah.
I mean, I've seen you guys, kind of ask each other, questions and get help, from each other. It's
Nobody
kind of
asks me for
cool.
help, I'm always asking her for help.
Are you kidding? That's really cool to see.
Because you are, like I said before, you are a much better doctor than I am, and with primary care you need to know a little bit about a lot, and so you need to know a little gynecology. Me as a specialist, when they start talking about primary care problems, I put my hand up and say, go talk to your PCP. Let's move on. So
I'm not
I I don't need to ask you the questions because I'm just like, I'm not even going to try and help you. I'm going to send you back to your PCP.
Well, I appreciate the vote of confidence, but also sometimes see the thing with the world of primary care, what I've learned is like there's a lot of, I've been in this business long enough now to see differences, like institutional differences, and I've worked in enough jobs where okay, this place does it like this and this place does it like this, like it little things, right? And it's hilarious to me that like a lot of little like institutional things are just kind of depending on whoever is in leadership, right? Like whoever their medical director likes this, and so there's an emphasis on this, and it's so funny to me. But there's oftentimes when you move around, you will see like, hey, this is a tenet I've learned in medicine. I've been doing this for 20 years. And now all of a sudden they're not doing this. And I look it up. I'm like, okay, there doesn't seem to be anything different in the literature. I can't imagine that there'd be something ground shaking this. And so that's when I do things like go to Dr. Ray, like people who know what they're doing and have been doing this for a long time.
Yeah. Well,
So
yeah, I mean, I know a lot about a little part of medicine. And
A
so,
lot about a little part of medicine. Okay.
but you know a little about a lot of medicine, right? The jack of all trades.
Wow. Well,
yeah,
I
sometimes it's a little
remember
terrifying.
I remember a weekend getaway and we're all kind of just complaining how we got there and the traffic and the meetings and Dr. Ray goes, I just delivered 8 babies today. And we're all just shut up. And we're asking all these questions, medical questions, and Dr. Ray immediately goes, if it's not below the waist and you're not a woman, don't talk to me. Go ask Dr. Foz. And that was like decades ago. And to this day, my dad would be like, oh, you're gonna see Dr. Ray? Could you ask her about this? I said, I don't think you're Dr. Ray's patient.
I used to tell my dad that too. He would start talking to me and he goes, what do you know about tryptophan and its effect on cardiac muscle? And I'm like, Dad, are you a woman? Do you have a uterus or a vagina? No? Okay, then I cannot help you.
Bam! Shut them down.
Yeah.
And poor Dr. Foz. Dr. Foz, like, what do you think? What do you think? I just want to, we're getting to the end of this. I just want to ask some question. I don't know how much you guys know about it, or that 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 virus from the cruise ship.
Oh.
Oh, hell yeah.
Oh, the
Help
Yeah,
us.
hantavirus.
so
Educate us, honey, because
Okay.
it is getting crazy.
All right. So since it doesn't affect vaginas, I will defer to Dr. Foz.
oh no.
This is
No,
where
no,
I'm
not
like,
the non-vagina
Hey,
question.
look at that! Did you see that cop
I'm
out?
like,
Look at
I'm
that.
like, all right. What is that?
Okay,
Okay, that's
so
not a
what you
vagina
need to
question.
know about hantavirus is that the risk to you is extremely low. It's really hard to catch this stuff. Hantavirus is not unheard of. It does still occasionally happen. It's usually um, in isolated pockets of places. It's not widespread. Um, it requires either so the type of hantavirus that's found in the United States requires contact with like rodent. Usually it's going to be rodent like excrement, right? So if you have like a rat infested house or something. But that's not, even in that population, that's not super common. Like I don't think you're going to find hantavirus in like the heart of Chicago kind of stuff, which I understand is like the rat capital of the United States. Um, but the type they're talking about regarding the ship was thought to be from a pair that had gone bird watching on an island that has a lot of rodents and probably picked it up like crawling around in the bushes looking at birds, if that
No,
makes
they
any
they
sense. Like
went
they're
to the
out there.
the trash or whatever.
Yeah, like
The
someplace like
landfill.
It was a
The
landfill.
landfill.
whatever. Like it's just like I don't know the details, so I don't know where they got it exactly. All I know is that they're some sort of uh like leisure activity that in a more particular part of the world that put them at risk. And then it spread outside of that through close contact, and ships are kind of close contact. And I don't know the relationships of all the people that have been potentially exposed, but because it requires close contact, it's not like COVID, right? Like where like, oh, somebody coughs or sneezes 4 feet away and you might get it. It's not really like that. So the real threat is not very great to the general public. When it comes to general hantavirus, like that is found in the United States, the strains are found in the States, it's also not common. You know how many cases of hantavirus I've seen in my entire career? A big fat zero. It's not
So
common.
let's
And
say,
then just
uh,
take common sense. Like if you have to clean up rat droppings, like wear a mask. Don't let them aerosolize. Like spray them down with bleach and then wipe it up and throw it away and wash your hands and things like that. Like it's just use good common sense.
now let's say someone from the cruise ship and is like lives in my neighborhood. Um, do
Don't
I
go have dinner
care?
with them until they've
Yeah.
passed the incubation period of like 42 days or something.
Wow, 42 days. Okay.
Well, a lot of viruses, how they were talking about, so I'm just going to use COVID as an example. You know how they were saying, do you remember early on in the pandemic, like if you were 10 days out, then you were cool? Like, even
Yeah.
if you had like full blown COVID, once you were past 10 days of illness, like, you might still have a runny nose or a little cough, but as long as you were better and not having fevers and it had been more than 10 days and all that stuff, then you could go out in public and you were fine. Like it was not a big deal. Did you know there's still something like 2% of people or 12% of people, some small percentage, I don't remember what it is exactly now, we're still contagious at that point. So, a lot of these like, oh, well, you're not going to get sick after the third day or something. That's not really, really true. And I think in this circumstance, they're calling it the full length of known infectivity because it has such a high mortality rate.
Got it. Wow. Okay. Well,
so it's not a huge threat for the average person. And just make sure that you handle any rodent infestations in your home with some degree of common sense. Having said that, even if you have rodents in your home, it's probably not a huge hantavirus actual threat.
Okay. That's good to hear. And I have like a few questions from our writers here. Let me just go through our, we have
Writers.
some feedback that we got from the public. Let me
I
go
thought
through
everybody who
it.
listened to that podcast was currently on here.
I know,
The only
right?
one we're missing is Beezus. Where's Beezus today?
Ooh, Beezus. See, you are
Beezus,
missed,
SJ,
right?
and yeah,
Oh, you're good
M,
with the memory.
and there's just a couple.
Yeah. So, getting getting a contrast. That's kind of when they put ink in your system and blah blah blah. How long does contrast stay in your system, and how do you know
Intravenous contrast for
uh
like
for like a
CTMI.
uh like for a scan?
Probably hours at the most.
Hours. Okay.
Well, probably not. I don't honestly know. It's not meant to be retained. I know that it has to be given shortly before the study, so it's probably completely removed within a couple hours. Like at that point, but I don't know.
Okay.
Never cared.
Okay. Good to know. Good to know. The second question we have here is LASIX. That's LISIX versus LASIK.
LASIK,
LASIK.
which is the eye procedure.
The eye procedure is LASIK. LASIX. I heard that when you get LASIX, why do you get LASIX? Or typically, why do people get LASIX? And
So
does
Lasix it's a loop diuretic. It's really the generic. Lasix is a trade name. The generic name is furosemide. And it's classically given for congestive heart failure, but it's given in times when you need to remove excessive water or fluid buildup for whatever reason. Sometimes used for hypertension management, though it's like not a great choice for that.
and does that make people go pee?
Yeah, it's a diuretic. It's
Uh-huh.
and so what that does is it takes extra water out of the body and has you pee it off.
Okay. And you have to go pee. I mean, there's no getting around it.
Well, you're gonna pee. It is sometimes given in patients who have some renal insufficiency, and so they may not pee as well, but yeah, I mean, you'll pee.
Got it. Okay. Anyone in the audience have any questions before we end this? This was a good episode.
It was. No, I'm actually still processing everything that we learned earlier.
Just remember, Department of Consumer Affairs is there to protect you, including from, like, the medical or healthcare uh, provider, like, point of view, like
Mhm.
social workers and all that stuff too.
Wow. All right. Well, if anyone that is watching, because this is now a video podcast, or listening to us, if you have any
What the heck?
questions for for future episodes, just send an email to question@betweendoctorsandfriends.com. And if it bounces, then what can we do? All right, that ends this episode.